1 year ago, I told you about Traumagel and how it had been cleared by the FDA. This is Traumagel. 1 year later, with Traumagel having been released into the wild, and we are seeing real-world results. And one area where we're seeing those results is right in my backyard with Cobb County Fire and Emergency Services here in Cobb County, Georgia, a service that I worked closely with for a decade and a half. They had early deployment of Traumagel, and they used it on their very first day, stopping a serious bleed on a fellow first responder.
We got trained on it at lunch and used it by dinner.
It was very easy to use. It stood out as a game changer.
If it wasn't for this type of technology, we don't know what the outcome would have been.
Traumagel is a plant-based hemostatic gel that can control significant external hemorrhage like a stab wound or a GSW, some sort of laceration quickly so you can move on to other patient care demands quickly. So just imagine it. You arrive on scene, your patient has an external hemorrhage. So you rip the package open, you take out the syringe, you unscrew the top, you apply the gel directly to the wound. It fills the wound, taking the shape of the wound, and hemorrhage is controlled. Bleeding control has never been easier.
So it used to be in the past, our first go-to would be direct pressure and then of course tourniquet use. When we discovered your guys' product, we're talking about seconds. You're talking saving 5 to 7 minutes to get somebody out of a traumatic situation and on their way to definitive care.
One of the other great things about Traumagel is once your patient arrives at definitive care, the gel washes right out with simple irrigation. 40% of traumatic deaths are from uncontrolled bleeding. Traumagel, an idea that began in a dorm room, is out there now and is making a difference.